Good morning. Today I'm going to talk about diagnostic medical sonography. My name is Hosanna. I'm 24 years old. I'm from Cuba. I moved to the United States when I was 19 years with my dad. A few months later, I started studying English for academic purpose at Eduardo Padrón College. After I finished the sixth level of English, I started with the pre-requirements of diagnostic medical sonography career. The reason of this presentation is because I will talk about important points of this profession, such as salary, job description, education. I also interview a professional in this field. Now I will talk about the history. Lazarus Spallanzani was the first scientist to write about the use of sounds in special orientation in 1794. He deduced that bats use the echo of sounds to orient themselves in the total darkness. In the middle of the 20th century, Ian Donald introduced ultrasound to diagnostic and medicine in 1956. He's considered the father of ultrasounds. He used a one-dimensional 8 mode where he assigned to measure the fetal parietal head. Now I will talk about the education. There are several prerequisites before applying to the program. First, you must finish classes such as anatomy, physics, math, introduction to healthcare with the lab, and others. You must get good grade like A or B since the program is highly competitive. Final admission to the program depends on complete the CPR's courses, vaccinations, the hepatitis B vaccinations, and background check. This program begins in August of each year. The most common program for this career is the associate degree in science, which you can complete with full-time during 2 years. Medical campus offers it with an estimated cost of $9,102 with the 77 credit for the program. Sonographer doesn't need a license to work, but you can get the American Register for Diagnostic Medical Sonography, which is highly recommended. Now I'm going to talk about the job description. Sonographers play a vital role in the life of each patient. They have an extensive knowledge of anatomy and pathology. They make sure that the patient feels comfortable in a pleasant place. Before any procedure, they verify that the place and equipment are clean. Also, they explain to the patient the examination procedure. Sonographers use imaging equipment that emits some wave to capture the images of organs, tissues, and blood vessels. Also, they detect anomalies through this equipment, and then they interpret these images to present this to the physician. Diagnostic medical sonography can specialize in echocardiography, obstetrics and gynecology, abdominal, and also neurology. The scope of practice include procedures, process, authorized by the law. Now I will talk about the salary. In 2019, the national median wage for the sonographer was the $74,000. The highest pay was $89,000 and the lowest pay was $69,000. They earn a salary depending on the level of education, specialty they work, the hours working, and also the state they live. During this project, I have the pleasure of interviewing the sonographer Maribel Torres. I went to the Clinical Vital Imaging Medical Center. This clinic is in Coral Gable. I asked her like 10 questions. Maribel is a professional who is graduated from Matia College. She has an associate degree and also she's a certified sonographer. Maribel likes to help people, that's why she became a sonographer. This interview was 2 minutes long because you have to continue with the patient. In general, I got a good impression of the clinic and the professional Marvel Torre. In conclusion, this project helped me to understand better the profession, and also I'm happy with the experience, and I realized this is career of my dreams. Now I will show you a short video from YouTube about this profession.
To see, like a bat's flight through darkness. That's the short way to explain the science of sonography. Diagnostic medical sonographers use special equipment to direct safe, high-frequency sound waves towards a particular part of the body. The echoes of those waves are collected and turned into moving images that reveal inner body structures. These images are known as sonograms, or ultrasounds. The sonographer selects particular images and records them for a physician to use when making a diagnosis, or for monitoring pregnancies or medical conditions. Sonographers may specialize in obstetrics and gynecology, or in a specific area of the body such as the abdomen, heart, or the circulatory system. Diagnostic medical sonographers need good interpersonal skills to calm anxious patients and explain the process in a reassuring way. Sonographers' duties include keeping patient records, adjusting and maintaining equipment, and preparing work schedules. Most work is in hospitals and clinics or doctors' offices.
Thank you so much.